Hello, my name is Amy Nakajima. I am the Director of Sim Advancement and Innovation for Simulation Canada. It is my privilege and my pleasure to be speaking on embedding equity, diversity, and inclusion in health professions simulation, and I hope that you'll enjoy this presentation. I would like to start with a land acknowledgement. I currently live and work in Ottawa, the traditional unceded territory of the Algonquin Anishinaabe people. I seek to be a critical ally, and I strive to be mindful of the legacy of colonialism and to promote reconciliation in the work I undertake as a clinician, as a teacher, and as an educator. My speaker disclosure includes that I am an employee of Simulation Canada, and this presentation describes my experience participating in a project led by Colleges and Institutes Canada in partnership with Simulation Canada. The Director of Education and Community Engagement of Simulation Canada has reviewed this presentation to ensure the scientific validity and objectivity of the content, and therefore has deemed there to be little potential bias or conflict of interest in relation to the speaker's declaration and the content. After this session, participants will be able to name one equity, diversity, inclusion element that they would like to incorporate into their teaching. Describe how to incorporate an element of EDI into a simulation scenario. I'm very excited to share with you my experiences working on the virtual program. This was an innovative work integrated learning opportunity which was funded by the Employment and Social Development Canada's Innovative Work Integrated Learning Initiative. Colleges and Institutes Canada, CICAN, partnered with Simulation Canada and post-secondary institutions across Canada to develop and offer the virtual student program. As part of the program, 120 virtual patient simulations in both official languages were created, focused on 3 disciplines of nursing, entry to practice, paramedicine, and medical laboratory technology. And these simulations were made available to 4,000 students at selected post-secondary institutions during the 2021-2022 academic year. CICAN is committed to promoting equity, diversity, inclusion, accessibility, and decolonization in the virtual program. One initiative to support this aim was establishing an equity, diversity, inclusion working group. The members of the virtual EDI working group have a range of professional and personal lived experience. Our membership reflected the principles of diversity and cultural safety. We provided feedback to faculty creating the virtual patient simulations regarding the content and elements related to EDI in their scenarios. We also designed and delivered faculty development for the authoring faculty, and we also offered recommendations to maximize participation and success of students from underrepresented groups and those who face accessibility barriers. So I think this slide will be familiar to you. It outlines what exactly is a simulation, and this quote is taken from Barry Eisenberg et al.'s article. Simulation is a person, device, or set of conditions which attempts to present education and evaluation problems authentically. The student or trainee is required to respond to the problems as he or she would under natural circumstances. Frequently, the trainee receives performance feedback as if he or she were in the real situation. Simulation procedures for evaluation and teaching have several common characteristics. Trainees see cues and consequences very much like those in the real environment. They can be placed in complex situations, and they act as they would in the real environment. And simulation can take many forms, including virtual patient simulations. I think this slide is also familiar to you. It outlines the simulation phases. So in this model, the simulation activities planned during the preparation phase, and typically the simulation activity is immediately preceded by a briefing, which is also known as a pre-briefing. And after the simulation, there is the debriefing phase. And learners make sense of the simulation in the reflection phase. And in the final phase, the effectiveness of the session is judged, and this is an iterative cycle so that the evaluation phase will move into the preparation phase for the next iteration of the simulation activity. In the previous slide, all 6 phases looked equivalent, but in reality, the preparation phase is disproportionately large. I like to say that everything is planned during the preparation phase, including assessing learner needs, establishing learner objectives, writing the scenario, recruiting faculty and others, organizing space and equipment, and coordinating and scheduling activities, including a dry run. And the success of the scenario is highly determined by the amount of preparation the simulation is able to accomplish. The EDI working group wanted to support the authoring faculty even before they began writing their scenarios. So prior to this scenario writing stage, we designed and delivered presentations on EDI to our authoring faculty. We had created a library of EDI-related resources for their use, and we also conducted a needs assessment of the faculty, asking if they had any specific requests for assistance. And during the scenario writing stage, the EDI working group attended drop-in Q&A faculty sessions, during which we were available to answer any questions that the faculty might have related to EDI elements. We responded to individual author requests for help. We reviewed all the scenarios with regard to EDA content. And during that review, a number of gaps were identified, and we responded to those gaps by creating further resources. One of our members created a resource on race, nationality, ethnicity, and citizenship. I created an EDI glossary and guidelines for writing a land acknowledgement. And we also created an EDI faculty development module specifically for facilitators. I wanted to describe the EDI review in the preparation phase. So during this review, we assisted the authoring faculty to ensure that their choices of words were respectful, non-discriminatory, and inclusive, and that their content of their virtual patient scenarios demonstrated considerations and respect for racial, ethnic, cultural, gender diversity, as well as other identities, and that their content was free of stereotypes and bias based on gender, race, ethnicity, culture, religion, age, sexual orientation, ability, and other identities. The EDI working group encouraged authors to employ the use of visual and audio material which promote racial, ethnic, cultural diversity, and gender fluidity, to acknowledge the social determinants of health in their virtual patient scenarios, and also to consider the risks, experiences, and needs of disadvantaged patients and populations. So in summary, the EDI working group supported the authoring faculty creating virtual patient scenarios for the virtual program prior and during the scenario writing stage. Next, I'd like to share with you the briefing phase and how we supported our faculty during that time. I think this slide will also be familiar to you, and I thought we would start by defining what we mean by a pre-briefing or briefing. So we adopted the Anaxel definition of pre-briefing to describe what we mean by a briefing, an information or orientation session held prior to the start of a simulation-based experience in which instructions or preparatory information is given to the participants. The purpose of a pre-briefing is to establish a psychologically safe environment for participants. So, just like the preparation phase, the briefing phase also contains a number of tasks, which include creating a fiction contract, outlining confidentiality and the rules of engagement, describing the expectations of each person's role and responsibility, orientation to equipment, environment, simulation modalities, time allotment and scenario, articulating the learning objectives, and what to expect in the debrief. So in the EDI faculty development module that we created for facilitators of the simulation, we offered some suggestions to them, and we encouraged them to consider opening the simulated activity with a land acknowledgement, inviting a co-facilitator if the scenario includes significant aspects that are not lived experience for the facilitator, and if the simulated activity highlights Indigenous healthcare needs, to please consider inviting a person from the community as a content expert to help co-facilitate the discussion, and to consider how do we check our cultural lenses that overtly and covertly influence our norms, behaviors, assumptions, and expectations. As mentioned earlier, the EDI working group supported authoring faculty prior and during the scenario writing stage. We also supported facilitators through our suggestions how to conduct a briefing phase through an EDI lens in the EDI faculty development module that we created. Here is a model of the various simulation modalities. And as you can see, virtual patient scenarios are a subtype of computer-based simulation, which in itself is yet one modality of simulation. And it is ironic that the simulation itself can last 15 minutes and yet may take days and weeks and months in the preparation phase for it to be successful. So the fourth phase of our 6-phase model is conducting the debrief. In short, debriefing is a facilitated reflection in the cycle of experiential learning to help identify and close gaps in knowledge and skill. It refers to the conversation about the simulation experience that traditionally occurs post-event, in which facilitators strive to promote reflective processes essential for learning, but also to provide learners with information about their performance to help them improve. The EDI working group made a number of suggestions in the EDI faculty development module for facilitators to conduct debriefing through an EDI-informed lens. Facilitators are encouraged to consider opening the debriefing with a land acknowledgement, utilizing a debriefing model that highlights different ways of being. Facilitators were encouraged to consider how to effectively and respectfully address EDI-related learning objectives, and to consider the diversity of the participants in the debriefing, and also, importantly, how they themselves are influenced and informed by the cultural groups to which they belong. Facilitators are encouraged to continue asking themselves, how do we check our cultural lenses that overtly and covertly influence our norms, behaviors, assumptions, and expectations? The reflection phase is the 5th phase of our 6-phase simulation model. Oftentimes, we refer to the debriefing phase as a space for reflection. The reflection phase, in contrast, is a time for individual reflection outside of that debriefing. Learners make sense of the simulation in this phase with reference to their previous experiences and those which are planned to take place. Learners may be encouraged to use resources to facilitate the reflection in this phase, for instance, through the use of portfolios. The last of our 6-phase model of simulation is evaluation. This activity is defined as a systematic approach to the collection, analysis, and interpretation of information about any aspect of the conceptualization, design, implementation, and utility of educational programs. Methods that have been used in program evaluation include questionnaires, interviews, focus groups, site visits, and group consensus techniques. The authoring faculty have been very busy during the fall of 2021 writing the virtual patient scenarios. Currently, these scenarios are being pilot tested and the evaluation of the program is being undertaken. This brings me to the close of my short presentation on my experiences being the chair of the EDI working group for the virtual program, which is a collaboration between CICAN and Simulation Canada. I thank you for your attention and for the opportunity for me to share my experiences with you. The learning objectives for the session included naming one EDI element that you would like to incorporate into your teaching, and describing how to incorporate an element of EDI into a simulation scenario. Thank you again for your attention.